Hello everyone, this is my first trial trying to record the videos in English. I had a lot of requests regarding this issue, so I'm going to try to upload the same video in Arabic and in English as much as I can. Today I will be talking about gynecomastia. It's a very common problem, and it does affect the person himself, the man, and the people surrounding him, his family, his friends, because it plays a role and it decreases his self-esteem and his self-confidence, which affects adversely himself and everybody around him. So gynecomastia means increase in the size of the male breast tissue. And this has to be differentiated from the word pseudo-gynecomastia, which means increase in the size of the breast tissue in males, but due to the increase in the fat deposition in that area, and not increase in the glandular tissue itself. And here I would like to stress on the point that the glandular tissue is different than the fatty tissue, in that the man or the doctor, when he examines his patient or the male patient when they're coming into the clinic, has to differentiate between peeling into a disc-like material exactly behind the nipple and in comparison to the fatty deposition that comes into the whole breast tissue. So gynecomastia is common. It affects one male into 4 males at least. It can affect one side of the breast or both sides of the breast. It can cause discomfort, and this discomfort can reach to a level of tenderness and pain, annoying the patient himself. And it can be accompanied with nipple discharge, and this as well can cause a lot of concern for the patient. So gynecomastia does affect the man socially. A lot of men choose not to wear tight tops or t-shirts. They avoid swimming into public swimming pools so that nobody can know that they have this issue. Gynecomastia can affect males in 3 stages of their lives. At infancy, when the newborn, you can check out their breasts and they can be enlarged, and this is due to the effect of the mother hormones. And this usually does not last for a long time. Maximum it can last from 3 weeks up to 6 months, but eventually it will disappear. It has no significance whatsoever. And then again, males can be affected with the gynecomastia at the puberty phase, and here it happens due hormonal imbalance. We all know that there's estrogens and androgens in males and females, and not to the misunderstanding that females have only estrogens and males have no estrogens whatsoever. That's a misunderstanding, because both hormones are found in both genders, and due to imbalances and if an increase in estrogen or a decrease in androgen with males takes place, then this one of the effects can happen to be gynecomastia. So at puberty, usually because of the puberty phase, some imbalances can take place, and then they can cause gynecomastia. Up to 90% of those cases usually resolve on their own. We need to do nothing about them, just reassurance to the patient and tell them that they're going to be all right, and it has no significance whatsoever, and it's not cancer, and it's nothing to be scared of. Later in life, in 50s and 60s, men can also suffer from gynecomastia. We need to rule out in every phase, when we face gynecomastia, any underlying causes, because usually if we treat the underlying cause, then the gynecomastia can disappear. For example, if the patient is taking medications that are known to cause gynecomastia, when we stop those medications or replace them with other medications, then gynecomastia can resolve. As an example, we can say cimetidine, which is an H2 blocker used for as an anti-ulcer medication. Some of the drugs that are used in heart failure, like spironolactone, the amphetamines, and other drugs. As well as some diseases can also cause gynecomastia, like hyperthyroidism. And once you start treating hyperthyroidism, gynecomastia is a reversible trait. as well as some of the syndromes can be accompanied with gynecomastia, but we have to take care, like one of those syndromes can actually be accompanied with a high risk for male breast cancer, so we need to rule out male breast cancer. The relationship between gynecomastia and male breast cancer, there is no relationship whatsoever, but because breast cancer can mimic the appearance of gynecomastia, so we need to rule out breast cancer in a male that is visiting the clinic for a case of gynecomastia, because they usually cannot differentiate. Plus, the symptoms of breast cancer can vary from a breast mass, breast ulceration, nipple retraction, nipple discharge, and many other symptoms. So we always need to rule out any sinister causes that are underlying that trait. And when the puberty phase finishes, or we try to rule out any underlying cause for gynecomastia, and the gynecomastia does not resolve on its own, we need to interfere. And interference can vary. We can start with medications. Some of the medications that can be used, but they are not FDA approved, they are only approved for breast cancer and not approved for gynecomastia, are the tamoxifen. As an example is the tamoxifen. It did improve some cases of gynecomastia. And other options would be radiotherapy, radiation therapy, and then we go to surgery. Here in my place in Jordan, we use surgery for gynecomastia, which is proved real gynecomastia, not pseudogynecomastia, as I mentioned earlier. And if that gynecomastia is accompanied with fat deposition, then we can do two things at a time in surgery. We can do liposuction for the fat and then glandular excision of the glandular tissue of the gynecomastia, so to give the best results for the patient. And that, of course, depends on the severity of the case, because gynecomastia can be divided into different stages. One of those classifications or stages would be mild gynecomastia with no skin excess, moderate gynecomastia with no skin excess, or moderate gynecomastia with skin excess, and then severe gynecomastia mimicking a female's breast. I tried to summarize gynecomastia in a few words. The last thing that I would like to say and repeat is that gynecomastia has no relation to breast cancer. Gynecomastia does not cause breast cancer in males. Breast cancer in males is about 1% in the general population. However, the gynecomastia is a very common thing that can actually affect males. I hope that I did summarize it as much as I can.